Um, I'm going to talk for a little bit about the pediatric behavioral healthcare focus, which is a particularly exciting part of the PAU experience. And then hopefully you'll have some questions or comments that I can respond to as well. First, as a means of introduction, let me tell you who the team is currently that's delivering the pediatric behavioral healthcare focus. There's me, there's Dr. Cordova, and Dr. Bunge. All right, so what is this new focus? This is a new area that is new to PAU, new being this is our end of our third year initiating this. This has been a growth area for psychologists probably for the last 6 to 7 years. And so we have made the switch to focusing on pediatric behavioral health care instead of the generic child and family area, probably 3 years ago, once I became head of the emphasis area. Now, let me just hit you with a few sort of key principles and then some data. One thing is that this move has been stimulated by recent bench science. For those of you who follow clinical child psych and pediatric psych, that the move to integration of pediatric behavioral health care is spurred by the notion, by the developments that, for example, 50% of all pediatric health visits have a behavioral health component. And if you think about that, that's remarkable. That is a remarkable amount of complaints, right? And pediatric primary care in particular is burdened by that. If you either have a child or I'm assuming most of you have been children and you've been to a pediatric clinic, you realize that the wait time is enormous. And that's because if pediatricians and their offices are not set up to deal with behavioral health care complaints. And that extends, the consequence of that is that extends the length of their visit, which extends the day and delays patients being seen. So they are looking for ways in which to streamline that. And there are also pediatricians, while they have some basic behavioral health care training, are not equipped to deal with the variety of things that come through their office. The other thing is that when you ask patients where would they like to receive pediatric behavioral health care, in essentially a mental health specialty clinic or in a specialty or in a generic pediatric behavioral health care setting where they are seen for their ear checks and vaccines and all those other things, they prefer to be seen there. Because when you actually then look at the experience of those patients who receive care in their pediatric settings, they find it destigmatizing. So if you're interested in destigmatization of mental health issues, this should really resonate. The other part is if you're interested in access, right? There's greater access to a pediatric office than there is to a mental health clinic. So that's why this is just a robust area. Another thing is the clinical advances that have occurred In particular, what is effective in treating most childhood disorders, and in particular, the behavioral health components of chronic medical conditions is cognitive behavior therapy. And cognitive behavior therapy has emerged as the gold standard treatment for the wide array of disorders. If you follow politics at all, that you know that healthcare reform is a big deal. Not to get too political, but when we had the Affordable Care Act, that was the thing that stimulated the importance of integrated services. The Affordable Care Act is essentially trying to increase access and decrease cost and increase accountability. And therefore, this gets kind of integrates the health reform initiative and the bench science that's occurred, is that if you look at where there is a greater emphasis on clinical accountability, on delivering the best service to patients, to particularly pediatric patients and their families, that occurs more in pediatric settings than in, let's say, community mental health settings or typical child guidance settings, and certainly more than in private practice. Lastly, is given all these things, we need a lot of well-trained, well-equipped psychologists to essentially become hired in these settings. The need and the demand is high. That's particularly important for any of you who want to get a job. I won't ask you, but I would imagine that hands would go up that a large percentage of you want to get a job that pays well after you leave here. Let me just hit you with this statistic that from a 2018 workforce study, that there are 188,000 general practitioner psychologists, right? About, roughly 200,000. There are about 300,000 social workers that deliver care to children, to patients, sorry. Comparatively, there are only there are about 2,400 well-trained clinical child pediatric psychology students, right? Or people who have been through those trainings, that graduate training. That is a problem. It's a problem for the field. It's a problem for the patients. We are never gonna, scale up the numbers that we need to meet the need, but we're woefully lacking in that. So the consequence of that is you're having social workers and counselors who are being fed into, the need still exists, who are not as well trained as doctoral pediatric psychologists, or you're having some psychologists who have general training trying to deliver pediatric psychological services, which is a problem because they don't do as well. And if they don't do as well, what will happen is that the default option would be that they then go to the lowest reimbursed level, right? They'll hire the essentially cheapest workers, which tend to be master's level. So therefore you're shrinking. If essentially we as a field don't produce these type of competent people, it's going to go to somebody else. right? Because the need is there. So most forward-thinking places have already begun this training. Many of them are now definitely starting. We're not the first, but we have been, we're not the last. And so this is a really nice new initiative for us that opens up a lot of great scholarship. And more importantly, I think, serves patients better and gives you guys a chance to have a marketing brand that is portable. Okay, so that's why we did it. Now, what does it do, and how is it better than a generic child and family emphasis? What it does is it gives you every skill that you need for child to be. If you go into pediatric behavioral health care and you say, hey, I don't want to work with kids who are in a medical center or a pediatric clinic or a GI clinic. I want to do private practice, or I want to do child guidance work. You'll have all those general skills plus the specialty focus to deal with every diagnostic category that is relevant to pediatric work or clinical child work, plus the skills to know what to do when you have comorbid medical conditions. So it's much more applicable, much more flexible, and again, if we break it down to the most actionable thing for you all, that if you want to get a internship in a medical center, when you're applying to internship, you need to have that. They're not looking for generalists. They're not looking for people who have clinical child psych backgrounds. They want to know, can you work with pediatric psych patients, pediatric behavioral health care patients? And even if you don't want to do that and you want to get a child guidance clinic, the thing is, how many patients do you think you might see in a general practice clinic, in an outpatient mental health clinic, that have headache, stomach ache, asthma, all of those things? Cystic fibrosis. Cystic fibrosis is highly prevalent. If you want to work with marginalized populations, sickle cell anemia, that the comorbidity of psychological problems with those type of abdomen, with asthma, headache, pain, GI, etc., is pervasive. So that's what it does. Now, how do we equip you with state-of-the-art skills? Well, we equip you with state-of-the-art skills through didactic and experiential learning. And here are the course requirements. First one is Developmental Psychopathology 1, and I'll just leave that screen up there for a second. Essentially, you can't work with kids unless you understand developmental psychopathology. That's one of the problems when essentially a generalist tries to get into tries to work in a specialty clinic. So we have two courses. One is, it's split up, Developmental Psychopathology 1, which is 0 to 18, and then Developmental Psychopathology 2. So 2 courses in developmental psychopathology, because you got to know what you're dealing with not necessarily from a DSM-5 or a Diagnostic Statistical Manual 5. That's essentially the where you come up with the diagnostic codes, but it's how did they get anxiety comorbid with asthma? What's the biopsychosocial trajectory that contributes to those disorders? Then, of course, we have clinical practice of pediatric psychology. This is a specialty course that deals with comorbid medical conditions from, as I mentioned, asthma, GI distress, chronic pain, headache, diabetes. Think about that, diabetes, right? How common is that? Obesity, cardiovascular disease. I don't know if I mentioned epilepsy, sleep problems. And again, think about that, sleep problems. Even if you have a kid who does not have a comorbid condition, how many anxious, depressed, behavior problem kids have sleep problems, right? You have to know how to deal with that. Big focus, enuresis and encapresis. This is something that we are specially trained to deal with, and that is common in, certainly is common in any pediatric clinic, but in mental health clinics, as well. So all of those, if you could think about all the both acute and chronic medical conditions and their associated psychological features, that's what this course deals with. And it's a very focused course there. What you leave with in this course is both an understanding of the medical condition, an understanding of the psychological condition and how to assess it, and most importantly, how do you treat that? Again, a common problem when you start to work in a pediatric clinic is you're going to get referrals for kids who can't swallow pills or who are non-compliant with their medical regimen. And how do you have to know how to deal with that in 2 sessions at most, right? And what's interesting is, and what I find most exciting about that is that type of work is, if a child is particularly with an acute or life-threatening chronic illness, if they're non-adherent to their medicine and you get them to be adherent to their medicine, you're saving their lives, right? That's life-changing work. So then we naturally, is not surprisingly, a huge focus in this course on the effective ways to deal with medical non-adherence and pill taking. Not surprisingly, health psychology. Here it deals with, you can see the range of different conditions. It's more of a generic health psychology course that includes adults as well as transitional age youth. Then we have this course, Behavioral Healthcare Administration. This is a brand new course that is, again, probably about 3 or 4 years has an age of 3 or 4 years, that I introduced to the curriculum because in my previous life, I used to work at Penn State Medical Center in Hershey, Pennsylvania. And I ran a clinic there. And nowhere in my experience, in my graduate school experience, did I learn how to be an administrator, how to manage a clinic. And so I learned the hard way through trial and error. I made a lot of mistakes, but essentially became self-taught because there were no courses there. And if you want to progress, if you want to separate yourself from both your PhD peers, PhD and PsyD peers, as well as certainly from master's level people, being equipped with administrative, management, and supervision skills in a practical way, not theoretically, but how do you manage a budget, right? Let's say you have $1 million budget. That's a lot of money that's entrusted to you. How do you manage it? How do you manage a crisis right now, right, where you're going to lose income? And how do you keep your staff, right? Additionally, what we talk about in this course are both there's a whole section on clinical supervision, but more importantly, there are things that we talk about there in terms of you don't usually get in lots of graduate programs, which is what about the principles of supply and demand, pricing structure, all of those type of things, marketing. This is a unique thing that only a few programs right now are offering courses in this. And but it's one of the competency areas that you need to be a pediatric clinical psychologist. It's really interesting is that when they came out with the pediatric competency areas, this is one of them, but very few programs have any didactic curriculum that helps you do that. And for people who want to go into private practice, this is really important to understand how that, because if you are a private practice practitioner, what you are basically is a entrepreneur with a small business. So you have to know how to do that. You have to know, again, what your price point is and the competitive demand for your service, and how to budget, how to allocate. Well, my first, the reason why I'm just elaborating this a bit is because the quarter starts on Monday, and that's the first class I'm teaching is this one on Tuesday. And one of the things I say is, psychologists have this love-hate relationship with money. They think that essentially it's a bad word, but everybody likes it. And they say, no, well, I just want to help people. And that's fine. That's a good thing that everybody's in the field to do that. However, if you go out of business, you're not helping anybody. And that's what you see essentially in a lot of poorly run clinics and poorly run systems, is that the behavioral health gets mismanaged, and they start to hire essentially, I would call mid-level professionals, master's level professionals, and or the services are eliminated. So if you're interested in helping people and you want to increase access, you have to know how to be able to run it in at least budget neutral and hopefully in the black. If you run it in the red, you're going to go out of business and help nobody. So that's essentially the behavioral healthcare administration course. One of the fun things in that course, you can tell I love this course because it's so different than any other psychology course. We actually give you a budget at with numbers and all those type of things, and that you have to manage through the course of the class. And we give you crises to have to be able to manage so that your clinic survives. Okay, so that's the curriculum. Whoops, sorry. Then those are the 5 required courses. And then you can pick one of these: Health Psych 2, Transdiagnostic, Substance Use. This is a new course that we're hoping to add just this year, which is Diversity Issues in Pediatric Psychology. So 5 required courses, one of these electives. You have to complete, not surprisingly, you have to complete a dissertation in the behavioral healthcare area, broadly defined. So something with somebody 0 to 26 that has a behavioral healthcare issue, whatever that might be. So that's really pretty broad, and encompasses a lot of potential topics. You have to complete a practicum and/or an internship in healthcare setting. The practicum part is relatively easy because there's so many practica in the Bay Area that have this type of focus. The internship, to be honest with you, is much more competitive. But since we've really focused on refining the curriculum, we've been extremely successful. Last couple of years, we're in the low to mid 90s around of internship placement. And we've been really happy with the places that clinical child pediatric psych people have been going. So that's the curricular and experiential area, or the way in which we train you. We also have special augmentations of that, where we invite some people from the community to come in and give you really state-of-the-art extra training. This is one that was done by Jennifer Park at Rogers Behavioral Healthcare in Walnut Hills. That's for those of you not familiar with the Bay Area, that's something called the East Bay. And Rogers Behavioral Healthcare is arguably one of the top 3 places for receiving care for anxiety and OCD. So to have Jennifer Park come in and do a talk on how to treat pediatric OCD was a real get for us. We also brought in Jess Shatkin, who is at NYU Langone Child Study Center. Again, probably either the top or the second best pediatric clinical setting in the country. He's written, by the way, if you have some leisure time to get a book, he has a best-selling book called Born to be Wild. It's a popular book on the nature of adolescent risk-taking and how to deal with it. It is an awesome book. For those of you who are on Twitter, following him on Twitter is great because he has lots of interesting things to say. And he is a great, for those of you who have Sirius Radio, here's a quick, the satellite radio, here's a quick tip that About Our Kids, which is a show that is powered by NYU Langone, has interviews, and they're essentially like continuing education. It's not like Dr. Phil or anything like that. It's a continuing education type of thing where they bring in national experts to talk a variety of different pediatric and behavioral health issues. And Jess is one of the hosts of that. We had a grand rounds with Rob Holloway, who is one of the directors of a huge and successful private practice in this area, on teaching students the key elements to how to build a private practice. Michael Tompkins, who's the director of the San Francisco Bay Area Cognitive Therapy clinic based out of Oakland, came in with case conceptualization. If you're not familiar with Michael, his books are award-winning. He just has a brand new one out on treating childhood OCD and anxiety disorders. He has actually a book for kids called Your Anxious Mind, which is, again, a popular self-help book for kids. Again, if you have free time and want to read up, Mike Tompkins is, again, a major player in the area. We had Brian Borsari from University of California, San Francisco Med Center come in doing motivational interviewing with adolescent patients. Should you come to PAU, you'll learn that that motivational interviewing is a core skill that we teach you throughout those six courses within the special emphasis area. Then we had a couple of visitors from Brazil. Dr. Wilson Mello, who talked about DBT, came in and talked about DBT with adolescents. Deborah Fava talked about working in schools. Both of them are well-recognized psychologists. Wilson is the president of the Brazilian Cognitive Behavioral Therapy Association. Kate Margolis came in April to talk about integrated pediatric behavioral health care. She is developing one of the major sites at UCSF, University of California. For those of you not from the area, University of California, San Francisco Medical Center of Integrated Behavioral Health. She also is launching a very well-established program called Healthy Steps at UCSF, and is working with us to kind of coordinate a bit. And Billy Vaughn came in and talked about diversity, inclusion, and leadership in behavioral healthcare services. Is that how do you become a diverse? How do you be a leader who facilitates diversity and inclusion in your clinic? And how do you compel funders to see diversity, inclusion as a marketable strategy? One of the nice things, one of the great things that Billy talks about is that any agency, any institution that fully embraces diversity and inclusion does well more financially than others. And again, he shared some data on that. So that was kind of a cool May Grand Rounds. So those are the didactic types of things. Now, what can you do? So one thing is we try to model within the emphasis area what we teach, and that is accountability. And accountability is, okay, so what's the what type of outcomes do you have? I mentioned some type of things where we talked about the internship rate. And then we have this thing, which is what can you do with emphasis, with a degree with the emphasis area of pediatric behavioral health? Well, here's some bios of some recent graduates. This is Jenna Paternostro. Let you read her bio. Jenna is now a faculty member at the University of Iowa Medical School, and she is responsible for integrating psychology within all the pediatric clinics within the system. She's also the co-editor of a brand new book, Cognitive Behavioral Therapy for Pediatric Medical Conditions, which is gaining a lot of nice traction and regard. So I'll just leave that up for a second for anybody who's still reading. This is Paul Sullivan. Paul Sullivan is currently, again, on faculty at New York University School of Medicine in the Division of Child and Adolescent Psychiatry. For those of you who are taking notes or have really good memory, that's either the first or second best program in the country. So we're extremely proud of Paul. He did his pre-doc, as you see, at NYU, and he did his postdoc at Cornell Presbyterian. That's an Ivy League medical school. So and you can see what his current work is. And I'll just leave that up for a few seconds, those of you who want to read it. And again, what Dr. Sullivan and Dr. Paternostro are doing is they are integrated. They're doing exactly what our training model focuses in on, which is being a practitioner scientist. So they are seeing patients and doing research with the patients they are seeing. So there's a seamless integration between clinical work and scholarship. That's Michaela Thorderson. She is the director of the Aspire program. As you can see, the acronym for that at Children's Hospital of Orange County in LA, which is a large and growing pediatric center. She's in addition to a number of, as you see, there's her articles and presentations. She's got an instant bestseller called CBT Express out of Guilford Publications. This is Sweta Ghosh. She's the most recent, of all these four, she's the most recent graduate. She did her internship at Case Western Medical Center, Metro Health. I think I saw somebody who's in Cleveland, right? So you guys are aware of that place. She worked, when she was at Metro Health, she's working with one of the pioneers in pediatric psychology called named Dr. Terry Stanson. She's currently finishing up her postdoc at Seattle Children's, which is a very, very fine children's center in Washington State, in Seattle. And I'll leave that up for a little bit. All right, so that's what we do, but that's not enough for you guys to really kind of be, and that's what I tell my students, it's what I tell every applicant. It's not enough to know just what we're doing, because you have to know what's going on in the broader area, in the broader world of pediatric psychology. So here's some places that you should really check out as you're looking for programs that really meet the current initiatives and workplace demands. This is a division of APA, Society of Clinical and Child Adolescent Psychology. There's the link. One of the things that I tell students, the emphasis is you've got to be a student member. So you join APA, and if you become a student member, you can be a member of the division for free. Not surprisingly, there's the Society for Pediatric Psychology. There's the link. You can see all the things that are going on there. You could actually probably get on their list, that you can actually access these sites, even though you're not a member. You can't get on the listserv, but you can get on the listserv if you become a member. The Association of Psychologists in Academic Healthcare. There's this one. This is a great organization made up of psychologists who are working like Jenna Paul and Michaela in an academic healthcare setting. And Sweta. Again, when you're in pediatric psychology, you get out of the silo of psychology only, and you have to learn how to work with other disciplines, and particularly with physicians, nurses, occupational therapists, child life specialists, social workers, etc. So you want to look at what other professions are doing. To be honest with you, child and adolescent psychiatry is far ahead of American Psychological Association in fostering integration in the healthcare system. We've got to catch up with them. But their work is really fantastic. If you want to see how it's done, go ahead and look at the ACAP site. What I also try to do with my students is I try to have them present at non-psychology conferences, at conferences where they're going to be able to interact with people like physicians, nurses, etc. And of course, American Academy of Pediatrics. So there's some websites to kind of get information, so you can kind of see. Don't take my word for it. Don't take anybody's word for it. Look at it for yourself. See where the trends are. Shape your career not by any one program, but by whether a program fits with where the major organizations have discovered their initiatives and science breakthroughs to be. Here's some recommended reading. I'm going to just leave this up for a little bit. The other couple things I said, Jess Shatkin's book and Mike Tompkins' book are more kind of self-help book. These are more professional articles. You can see where, again, these, if you take a look at the journals, these are some of the major journals in the area. Journal of Clinical Child and Adolescent Psych is the flagship one for us. Again, I'm talking about as if you guys are all, hopefully you guys are all interested in clinical child pediatric. Journal of Clinical Psychology and Medical Centers is a great one. If you're only going to read one of these, I would look at Asternow and Kirsch and Ast. Interestingly, the article by Kirsch and Ast, that Daryl Kirsch wrote this article urging psychologists to get out of their silo and work with the medical community in integrated settings. Dr. Kirsch he just retired, was the president of essentially it's called the American Council of Graduate Medical Education, ACGME. So he was a physician, head of, again, graduate medical education, who's urging psychologists to do that. And there's a couple other ones. You can see Jenna's article up there. And of course, I'd be, remiss if I didn't mention, our book, which is one of the first to deal with pediatric medical conditions, came out in 2019. It's getting a lot of nice recognition. If you want depth of this, go ahead and look at it. It's pretty, it's a scholarly book that's very, very practical, but it will give you an overview of everything. And of course, look at our website. A lot of the highlight, again, it's a website, right? So it's, it's kind of Reader's Digest, but it has tons of information on the website, in particular, both what we do here, and it directs you to some important links in the field. I mean, actually, you know, you can take that link, or you just go to the PAU broad website and put in pediatric behavioral health, and it'll take you to the website. You can connect that. This doesn't have to be the end of our relationship, right? If you have other questions, you can communicate with me via email. You can follow me on Twitter. You can connect with me on LinkedIn. And you can collaborate with me on ResearchGate. So I'm going to leave that up if people want to copy those addresses. I have before I open it up broadly to questions, I have some questions that were pre-sent that I'm going to just take a quick perusal of, make sure I've dealt with. And then we'll open up broadly for questions, if that's okay. So first question is, this person is interested in trauma and wonders what's under the trauma focus and what's under the pediatric behavioral healthcare focus event. There is no overlap. Those are two different areas of emphasis. Some people have done both. You can, calls for a lot more coursework, but you can do both. There's nothing to say that you can't do both. It means you have to take extra courses. But there's no overlap, right? That the trauma emphasis helps you deal specifically with trauma. It does not have anything to do with pediatric behavioral health, right? There's not a focus, there's not a, you know, you're not going to get anything from that if that's what you want. Pediatric, and naturally trauma is covered in most of the courses to a great extent. So you're going to, I would say you get what you need from, you know, unless you want to focus on trauma, right? You're going to get enough trauma, believe me, in both sort of reading and sort of your own personal experience if you're in pediatric behavioral health. So yeah, I mean, if you want to specialize in trauma, you should go into the trauma area. If you want to specialize in pediatric behavioral health, you should go into this one. I think I talked about the practica. Again, we don't, you know, that most all students who are in the area, you know, get the variety of practica that are available. I think, again, if there's a slide that admissions has of all the different, there are just a lot of practice sites in that. No, there is no compensation for most. Somebody asked about that. Then somebody asked a little bit about how does it interact with other areas within pediatric behavioral health, like child life specialists, occupational therapists, those type of things. How to work with within a medical setting and be a member of that healthcare team is the focus of both clinical practice of pediatric psych, as well as behavioral healthcare administration and management. That's what we teach you to do, is hopefully how to manage those folks, but in the future, but also kind of how to be a team member. Okay, so those are the things I think that I didn't cover explicitly. Monica, is there some way we want to do a handle questions?
I think it would be okay if you have a question, go ahead and make a note of it in Zoom, and I'll call on you and you can unmute yourself and ask the question. I think that would be a good way to do it if anyone has question, go ahead and just put it in the chat, or let me know in the chat and we'll unmute you.
Do you want me to stop share at this point, Monica?
No, it's okay. Just, you know, in case people need to jot down your information. So, it doesn't look like anyone is typing anything. Oh, there is a question. Nadia Mazinani, by what year semester do PhD students at this program start practicum?
Second year. Every year, every second year student begins their practicum at the in-house clinic at Gronowski Center. That's essentially that's where you get your feet wet.
Where have some of your internship placements been?
My students?
Yes, sir.
Yes, okay. All right, let me think. I'll go back from most recently. And again, the way it works is usually you have 3 students a year in your research group that apply for internship. Let's see, this year, well, I'll go for this year. We had an extremely good year in our research group this year. We had the first ever student get placed at UCLA pediatric psych track. Again, for those of you not familiar with the area, and again, kind of remembering, I said, well, NYU is probably first, that UCLA is probably second. We'll let them fight it out whether they're going to be first or second. We had somebody else place at Kennedy Krieger, which is Johns Hopkins Medical School in Baltimore. We had somebody place at Geisinger in Pennsylvania. Geisinger is one of the places that is a leader in integrating behavioral health, pediatric behavioral health care throughout an entire system, healthcare system. Let's see, 2 years ago, Alexian Brothers in Chicago, very that large healthcare system. UCSF, that's University of California, San Francisco, in the child department. And let's see, now we're starting to strain a little bit. Lincoln Memorial in New York City. Lincoln Memorial in the behavioral health care unit. For those of you who are familiar with the East Coast, Lincoln Memorial in the Bronx is the busiest emergency room in the country. That was a good get for us as well. Let's see. University of Tennessee Health Sciences Center in Nashville. That actually, you guys are probably familiar with one of its affiliations is St. Jude. It's part of the UT healthcare system. So that graduate is worked both at multiple clinics as well as St. Jude. And University of Utah Health System.
Okay.
Is that we're now back 3 years. Going back 4 years, I'm going to have to really stretch, but that gives you that'll give you a sense.
There's so many you can't remember. Let's see. That was from Corey Baumgart, that question. Thank you. Emily Smith asks, does this emphasis prepare students to be APA accredited as a child clinical psychologist?
APA doesn't accredit anything. It doesn't accredit whether it accredits a program. My guess is that you're asking, does it count for licensure? Of course, right? But also remember that that licensure in almost all states is a generic license. However, it does set you up with the things to become board certified, which is way in advance for all of you who are applying. But being board certified, that's what ABPP, if you hear that behind people's names, that's what that is. And that's getting more and more important to get hospital privileges. But no, APA credits postdoctoral and pre-doctoral internships and programs.
Okay. Francesco Yepes, how early on in the program do students have to apply for their emphasis?
Second year.
Okay. Elizabeth Berry, how does the school support the process of internship placement, interviews, writing process, networking overall?
I'm going to tell you my bias. I think the support that you get for internship at PAU is its major selling point. Having worked at two major state universities, I have never seen a department support students more for internships. It's probably one of the reasons that the internship placement rate is so high for a freestanding university. You get a ton. You get coursework. You get an advisor in addition to your regular advisor. Your materials are reviewed multiple times by multiple people. Your site list is reviewed multiple times by multiple people. So that is, you can rest assured, that's one thing you can be extraordinarily confident in should you come here, is that the support you get for internship. And again, I'll just say my bias point is that's our biggest strength.
Okay, so there's two more questions and then we will end the session. First is from Brianna Harold. Can students complete work, dissertation, research, internships, etc., in an area, specifically autism, even though Palo Alto does not have any faculty who work with that population?
That's a really good question. Yes. However, so that, autism, and I'm assuming it's you're talking about child and adolescent autism, right? That would fall to anybody who's running a child or pediatric group. So Bungay or myself. And we have had people who do pediatric studies on autism. And again, generally though, you try to link up with people who have that emphasis area, who have that scholarly interest. The other part to be careful of is people's interests change. So what you come in with as a research interest may be very different than what you leave with.
Okay. And last question, sorry everyone, but this will be the last one. Are externships available or are these considered practicums?
Can I ask for, when you're talking about an externship, what do you mean?
That was Sam Johnston. Maybe he's typing or she. Well,
let me take a stab at it.
Oh, I am thinking of sources outside the school.
Sure. Okay. Yeah. And again, for those people, so externships essentially are sites that are not affiliated with the school, right? You can do a practicum at an externship site, right? However, they're relatively rare. It's not something that we greatly encourage because you're out of the area and so you don't have support from the faculty. However, some people have, life circumstances that require them to leave the Bay Area to pursue an externship. So yes, that happens on an individual basis, but it's not something that is hugely encouraged.
Okay, so there were a couple questions that were asked, and I'm sorry we weren't able to get to them. Dr. Freeberg, I'm hoping your email's there so they can ask you these questions directly after the webinar. So again, this was being recorded, and I believe everyone should be getting a copy of this video. If not, and you want to reach out to the admissions office and we can get you that link. But I want to thank everybody for coming, and thanks Dr. Friedberg. This was great.
Thanks.
And
Monica, thank you for coordinating this.
oh yeah, no problem. And I hope everyone is safe and healthy and stays that way, and have a good
there's
night.
my last slide, everybody.
Wash your hands, avoid touching your eyes, stay home, cover your cough or sneeze, keep social distance. Yep, everybody tell your friends. I know a lot of people aren't doing it, so thank you guys. Have a good night.
All right, bye everyone.